Thanks, Count Carla, and I too like to welcome this bill, Minister. I think it's quite progressive. It's very, very long overdue, and we've always said that inpatient charges have not been conducive to a service of a public health service, a universal health service, and this has been very, very contentious in the last number of decades. And we've always argued that inpatient charges have been a kind of a barrier to many, many people gaining access to healthcare. And even the collection of these charges is a very onerous kind of task. It's a very bureaucratic task, and I don't think health service, public health service, should be kind of chasing after people for inpatient charges. And obviously that has a very stressful kind of effect on people that have to access healthcare. And debt collection by debt collectors, I just don't think that's acceptable. Where people that have, run up a bill, they can't work because of their illness, and debt collectors kind of send them letters. May have just come out of a very, very serious illness. And that, again, is not conducive to universal healthcare and a very fair system. So I think this is welcome, and all these stealth charges do have an effect on people kind of trying to access healthcare in our country. Minister, just a number of things in relation to hospital car parking charges. I could never understand, nobody could ever convince me why people have to pay car parking charges in hospitals. I just don't see the logic in it at all. Really don't see the logic. Why people, when they go to a hospital, have to pay sometimes enormous amount of money per week to park their car. Sometimes they have to bring their car to a hospital. So I just don't get that. I just don't get it. If somebody can explain to me why people have to be charged to go to a hospital, to park their car. Sometimes public transport is not available, and then to be charged for that. And then it's disappointing that the National Children's Hospital, now they've capped it at €10 a day, but if you have to go to the hospital every day with your child, that's €50 over 1 week. I don't get that. Can you probably explain why that is actually being implemented in the National Children's Hospital in relation to the charges per day? And just the final thing, Minister, and I know you referenced it earlier in your speech in relation to Kaftrio. Now, there's obviously good news in relation to that 35 children that have access to that drug now. And I raised this with the Taoiseach today. I think it's unforgivable what that company done, Vertex International. They're a pharmaceutical company that are based in Dublin. To drag it out for 1 year, to deny them children that drug for 1 year is absolutely unforgivable. Giving Vertex Pharmaceutical Companies is based in Dublin, and the money they have made from that drug is obscene. It's absolutely obscene. They have made billions, not millions, billions of dollars in relation to that drug. Yet they dragged the HSE, and I don't actually blame the government on this, I actually blame the company, dragging this out to get more money from governments and families. It's unforgivable, Minister, unforgivable, and you'll probably agree with me that this should not have been dragged out for a year. Them children, them 34 children should have got that drug when they needed it. It should have been not, well, it's good that they have it now, but it's unforgivable that pharmaceutical companies have governments over a barrel in relation to price. Now, I know they have a monopoly on it, but it's unforgivable that the amount of money they have made on this drug alone, it's obscene. And hopefully this will never happen again, and there's lessons to be learned in relation to reimbursement and children not being given a drug when they need it. Thank you.
Deputy.